Hi, my name is Kim Foster. I'm a social worker here at MedStar Georgetown University Hospital's Department of Neurology, specifically in the MS clinic. Today, what we're going to do is we're going to talk about some frequently asked questions that I get as a social worker here in the clinic. But I also want to start with saying that today's presentation is going to talk about broad strokes and not very specific things, especially that center around insurances. And that's because we have so many different insurances that I don't know the ins and outs of all of them. But at the end of our presentation, when we have the question and answer period, if you have a specific question about your insurance, that will probably be something that we take offline and I help you from there. So saying that, why don't we get started? So the topics that we're going to cover today are durable medical equipment, or DME, home health services, home health aid services, long-term and short-term disability, Social Security disability, and counseling resources. And again, at the end, we'll have about 20 to 30 minutes of a question and answer period. So let's dive into durable medical equipment. What is DME? So DME items are items or devices that are medically necessary to specifically address a medical issue. So examples of DME are wheelchairs, hospital beds, bedside commodes, canes, crutches, and rollators. That's just an example of a whole world of DME. So who covers DME? Who's going to pay for this stuff? So that's a great question. And like I'm going to say very often in this presentation, it depends on your insurance. So we're going to start with the fact that Medicaid and Medicare both have DME coverages. Depends on what item is covered. So I'll give an example that shower chairs are not covered under Medicare. Okay. In terms of primary or private insurances, it is not required that they have a DME benefit. Some of them do, some of them don't. So if you have questions about your own specific insurance, that's something you'll need to call them and see what that DME coverage is for. What if you do not have insurance? What do you do? So there's a couple things, which is called private pay. So either you pay on your own, or we find some other ways to pay for that DME, and I'll talk a little bit more about that at the end of this slide. But so say your doctor says you need a walker. This is where we're moving to, and we recommend that you get a walker. Here's your prescription. If you have insurance, you need a prescription from your medical provider. And so then what happens? You have your prescription. Where do you find DME? So DME companies are big and small. They are all over the place. Some of them are even national. And really what it is you pick the one that you want to work with. If there's someone in the community that you already know that you like that company, great. The prescription can be sent there, or you can take your prescription there. The other thing is you can ask for referrals from community members, friends, or families. I will say that if you call me and say, Kim, I need your top referrals for DME, I can give you a list or help find a list of resources in your community that take your insurance, but I cannot tell you this place is awesome, this place is awful. I can only give you information that you would then need to research. Okay. I get a question sometimes about what if I need to replace my DME? I've lost it, it's been stolen, it's broken. What do I do? Depends on your insurance. I'm going to say that a lot. But I'll give you an example of Medicare if you need to repair or replace an item. Medicare often has rules about how often they're going to replace something. So for this example, I'll use a wheelchair. So with a big ticket item like a wheelchair, they tend to have rules around they will not replace it within 5 years. So if it's stolen, that's something that they will consider to replace. You will probably need a police report to prove that it was stolen. But say it's just broken. What Medicare will do is that they will work with you to have a technician repair it. And in that 5-year period, they're going to repair it and repair it and repair it until it cannot be repaired any longer. And if it's outside the 5-year window, great. Medicare, it's easier for them to say, yep, we'll give you a new wheelchair and we're going to assess what you need now because it's 5 years old. If it's within the 5 years, then they'll still make an assessment and figure out what they want to do. So my suggestion about any DME is that you be kind to it. You use it for what it's meant for, but be kind, because if it's broken and your insurance company says they're not going to replace it, then you are left to pay out of pocket. And for some of those items, it can be very expensive. So be kind. If you cannot pay for it, we talked about at the top of this slide, there's a couple things. One is that sometimes, depending on your diagnosis, depending on the time of year, there are grants or some private money that we can look at to potentially help pay for a DME item. The other thing is borrowing from friends, family, a community center. If you're involved in a church, somebody might have that rollator that you need that you can't afford. The other thing that I'll talk about is loan closets. So an example of a loan closet is in the District of Columbia. Iona Senior Services has a loan closet for any person in DC that needs to borrow some DME, and it's for free. You just have to find the right day where they might have the right item that you're looking for. And I'll also give a plug to donating to loan closets in your community if there is one. Because if you don't need that rollator anymore, someone in your community might that can't afford it. So I just say if we can pass some goodness and positive forward, that would be a good thing to do. The next thing we're going to jump into is home health care. Home health care is an umbrella of services. And so what those are services that are skilled, that come into your home when you cannot leave your home to go into the community to get that service. What might those services be? So physical therapy, occupational therapy, speech therapy, a wound nurse, home infusion, a specialized RN or LPN that comes out to do something very specific for you medically. And so those services have to be medically necessary. They're part-time, they're not long-term, and they're intermittent. So you can't have them for a significant amount of time. You also have to have them prescribed by a medical professional. So if you need wound care, one of your providers has to do a prescription for that. One of the biggest questions that I get is who pays for it? Again, it depends on your insurance. So I'll let you know that insurances are very different. We've talked about that. I pulled an example from a bigger insurance company in our area that provides insurances for the federal government. So I looked at their benefits for 2021, and they have a benefit for home health care services. And one of the services I'll use as an example is physical therapy, occupational therapy, and speech therapy. So this insurance company has that benefit, and what they say is that their copay is $30 to $40 for each visit, and also they put a limit or a cap on those services at 50 visits per person per year. And for this specific insurance, the way that I interpret it is it's not 50 for OT, 50 for PT, and 50 for speech. It's you get 50 visits around those three services, and however you spend those 50 visits is how you spend those 50 visits. Okay, so that's just one example of all the insurances that we have. For Medicare and Medicaid both have this option, and they cover home health services. I'll let you know that Medicare, it depends. There can be copays, there can be deductibles, so it depends on your specific insurance. In terms of Medicaid, if you aren't aware, Medicaid programs are state-run or jurisdiction-run programs. And part of that is the federal government says, hey, there's some mandated services that you have to provide. And then there's some that we're going to leave it up to you as the jurisdiction to make decisions on if you want to pay for it or not. So under Medicaid, PT, OT, and speech are not considered mandatory. Those are optional. I will say that I checked for Maryland Medicaid, and they do have an option or a benefit for PT, OT, and speech services. The one that I looked at did not show a number of how many times you can get that visit per year. So again, very individualistic. And then there's always private pay. So if you can afford it, you can have it, right? If you can't afford it and you don't have insurance, then that's something that we need to look at together in terms of charitable organizations or other medical facilities that might provide that service for free or for very low cost or a sliding scale. Okay. So how do you get connected to home health services? It's starting with your medical provider. Get your prescription, and then finding a company that you'd like to work with. Here at Georgetown, what we tend to do is our providers send a prescription to our MedStar Visiting Nurse Association, or VNA. And so VNA gets the prescription, they contact you, and they set up the service or whatever the medical professional is ordering for you. If you have another company you want to use, either we send you the prescription or we send it to the company of your choosing. So one of the services under that home health care in particular is home health aid services. And other than Social Security disability, this is the topic that I talk to most with people when they call me here at the office. And it's questions that I get from our medical personnel. And it's not always the best outcome or the best or the most positive information that people want to hear. There's certain options, so we're going to go through them. So under this umbrella of home health care, home health aid services are services that are coming to you in your home to assist you with activities of daily living. What might those be? Activities of daily living are getting out of bed, going to bed, bathing, toileting, getting dressed. So those are just some examples. And that's assistance that comes to you because you need help. You can't do it by yourself at home. It's a limited number of hours, and it's often a limited number of visits. Who pays for it? So private insurance, I'll use the example of that big company that provides insurance for the federal government. And under this specific insurance plan, they do not have a benefit for home health aid services. The way that I interpret it, they don't have it at all. And I looked at a couple others. So Medicare and Medicaid do have a benefit for home health aid services. With Medicare, and if you have a private insurance company that does have a benefit for home health aid services, these are some of the requirements that you're going to have. For home health aid services, you must have a skilled service in the home at the same time. Skilled services are what we talked about in the last slide. Those services, we'll use this example as physical therapy. So if you have physical therapy in the home providing services, you might be eligible to have home health aid services at the same time. It doesn't have to be the same visit, but just that it's co-occurring at the same time. Now, if that PT physical therapy specialist says, great, you've met your goals, we are ending physical therapy, you're done, it is more than likely that your home health aid service will end around the same time because now you don't have a skilled service in the home as well. Okay. Again, it's supposed to be short term, not many hours. What I hear from people when they're calling about it is about 2 hours, 2 or 3 times a week. It's not a whole lot. Some people can certainly get more, but the average that I've heard is 2 hours, 2 to 3 times a week. Medicaid does provide more. They provide more with the basics. Someone that I was talking with here in the district, she maxed out with Medicaid in DC at 8 hours per day, 7 days a week. She was reassessed during a hospitalization and was assessed to need 16 hours a day, 7 days a week. She couldn't get 16 hours a day until she was approved through a waiver program. There's lots of names for that, but basically it's a waiver program where the government is saying, it's Medicaid saying, we think this person needs to have more services because we want to keep them in their home instead of making them go live in a long-term nursing facility. So that's what these waiver programs are for. It takes an application. You have to apply for it, and they have really strict standards around the money that you make and the money that you have. They're going to look at if you have Social Security disability, how much is it? They're going to look if you make any other money. They're going to look at pensions. They're going to look at if you own a house. They're going to look at your savings account. They're going to look at your checking accounts. All the money stuff they're going to make an assessment for. But if you are approved and accepted into that program, you could potentially get up to 24 hours of home health care services on top of other services that are involved in that program, like case management, which can really be helpful. So if connected to that program, that could be really positive. Private pay, I'll say with home health aid services, if you've got the money, you can pay for as many hours as you want. You can get 24/7 for as long as you can afford it. The problem is that most of the people that I talk to cannot afford it because their private insurance does not have that benefit for home health aid services. So I'll give you an example. Companies for private pay, they tend to run in our area about $23 an hour to $50 an hour. And many of them also have a minimum number of hours that they're going to agree that they could send someone out. So for an example is a $25 an hour agency might have a requirement of 4 hours per visit. That would be $100 a day. So many people that I talk to do not necessarily have the funds to pay for that. So other things that we can look at is trying to find community money, grants, things like that. It depends on the time of year, depends on where you live, and it depends on your diagnosis very often. Doesn't mean that we shouldn't look. I can help you do that. How do you get connected? Really for Medicaid, you have to apply for that waiver program. If it's private pay, you just find a company that you want to work with. For the insurances, you can still work with a company that you want to, but you have to have that prescription and then find somewhere that accepts your insurance. Okay. So we're going to make a little switch. We're going to move trajectories here and talk about disability. So there's a lot of different things about disability. The ultimate thing is Social Security disability, which we'll talk about in a few minutes. But the first one I want to talk about is short-term and long-term disability. And basically what I'm going to talk about is through work or through private policy. And I'm going to tell you this is my only stat for the entire presentation, which is taken from the Social Security Administration. And that is more than 1 in 4 20-year-olds will become disabled before reaching retirement age due to traumatic events such as a car crash, as well as serious medical conditions such as progression of your MS, ALS, terminal cancer, strokes. So those are examples of that. So if you already have short-term and long-term disability through your job or private policy, awesome, that's fantastic. I don't hear that very often, and this is a good slide for you. If you do not have short-term or long-term insurance, short-term disability or long-term disability insurance, and you already have a pre-existing condition, the likelihood of you getting a long-term disability policy is pretty small because you might be seen as a financial risk at that point. It doesn't mean you shouldn't ask, doesn't mean that you shouldn't try it and do some research. But with short-term and long-term disability, it's basically programs that this insurance program that is going to pay you a certain amount of your salary while you cannot work due to an illness or an injury. An example of short-term disability is pregnancy. Many women go on short-term disability because while they're on maternity leave, they're not getting paid, but this short-term disability will be able to give them some funds to come into their home. What do policies typically pay? Short-term disabilities tend to run 80% of your salary, and then long-term disability goes down to about 50 to 60% of your salary. Also let you know that if you do not have short-term or long-term disability insurance, or if you do, that it's not going to cover enough to afford the life that you've been accustomed to living. What can you do next? Ultimately, it could be Social Security disability, but I want to talk about our jurisdictions in terms of if there's an interim plan or an interim program that might be helpful. And I'm going to start with the least positive answer, which is Virginia. Virginia does not have a state-run interim disability program. They may have county-specific programs, but I haven't been able to identify very specific information enough to put in this presentation. I am working with a woman in Arlington County who is trying to do some research for me. So if you're in Virginia and this pops up in the future, still contact me because I may have developed some more information. Okay. So DC and Maryland have some better options. So DC has the Interim Disability Assistance Program, which provides temporary financial assistance to those unable to work due to disability and a high probability that you will be approved for Social Security disability. So this is one where you have to apply for Social Security disability before you can apply to the DC program. Things that I just thought might be helpful is that for this DC program, you have to be permanently and totally disabled. So this is not a short-term disability program. You cannot have minor children in your home. You have to apply at the DC Economic Security Administration Service Center on H Street. That is a mouthful to say. And I listed the phone number below for you. And some of the things that you're going to need to collect, things that you're going to have to start, the basics. You have to basically prove who you are. You have to prove that you're a DC resident, that you've applied for Social Security disability, proof of your Social Security number, and proof of your disability. Maryland falls along the same lines. Theirs is entitled the Temporary Disability Assistance Program. Same thing, providing temporary financial assistance to certain low-income persons unable to work due to a non-job related medical issue for a short-term disability or while awaiting approval for Social Security disability. So a little bit different. You cannot have minor children in the home. Recipients of this program may receive benefits for only 12 months out of a 36-month period unless you have filed for Social Security disability, because then that would be considered long-term. And you have to apply through your county Department of Social Services. So Prince George's County, Howard County, Charles County, pick your county, contact social services there. Same basics of getting started. You got to prove who you are. So proof of Maryland residency, proof of your application for Social Security disability if you're going for long-term temporary assistance, proof of your Social Security number, and proof of your disability. So we've thrown around the words Social Security disability a lot, I feel like. So why don't we just jump in and talk about Social Security disability. So with Social Security disability, actually under the Social Security Administration, there's two programs. One is Social Security Disability Insurance, or SSDI, and the other one is Supplemental Security Income, SSI. So with Social Security disability, that is where you have worked enough hours and paid enough money into Social Security taxes that you now are eligible for that benefit of getting Social Security disability back to you. For those people that have not worked enough and put money into Social Security taxes, there's the Supplemental Security Income. And so that's for persons, and that's basically financial need based, okay? So where do you start with Social Security? It can be tough, and lots of decisions have to go into making a choice to move forward with disability. I say starting with your medical provider. Start having those conversations. Talk about where am I now and what is my future going to look like. Once you do that and you get a sense of maybe I should learn more or maybe I should file for this disability, then I just recommend that you go to the Social Security Administration webpage, which is SSA, so Social Security Administration.gov, SSA.gov. I find it an easy site to navigate through, and it has a lot of really good information, such as checklists on what to pull together before you start filing for disability. I'll also say to you that if you cannot navigate the system or that website and you want me to print out information and mail it to you, I'm happy to do it. That's something that we can do pretty easily here at Georgetown, okay? So a big question I get is, how long does the process take? How many months? So what I see and what I hear is that once you turn everything in perfectly, you should plan on 3 to 6 months before you get the outcome. If you're denied and there needs to be an appeal, and my suggestion to you is if you're denied that you always appeal, always. But then you need to add 6 to 9 months on top of the months that you've already spent. So it's not a very fast program. So I like people to be prepared for that time frame. Another question I get is paper versus online application. Up to you. Both are doable. I will say that the online application is faster because of the magic of the internet. When you put it into the computer, it goes straight into Social Security Administration. So you do not have to wait for the Postal Service and then with Social Security mail system to get to the person that is going to review it and then ultimately put it in the system anyways. But feel free to do either one. Lastly, I think one of the most important things that I've heard, and it's also addressed on the Social Security Administration website, is what if I don't have all my medical documents together? Social Security says do not hold up doing your application. And here's why. Is one, it takes a lot of effort to get all your medical records, right? All your MRIs, everything that you're going to need. So Social Security says, we're going to do that for you. When you do the application, you sign a release. And then Social Security Administration contacts, say, Georgetown directly, and then Georgetown sends them the information. So they're taking that step off of your plate, which I think can be really helpful and saves a lot of time and stress for people that are filing. That's great. So doing all of this can be stressful. Filing for Social Security disability can be a lot. If you're having any cognitive issues with your MS, it can be daunting to have to sit and do all these things. So Social Security allows people to help you do this application. So who can help? Your partner, a family member, a very good friend of yours. There are attorneys that you can pay to do the application with you or for you. The National Multiple Sclerosis Society has MS navigators that often are very helpful and supportive in trying to answer questions and provide guidance for how to fill out the forms. And then ultimately, myself, you can contact me and I can try to be as helpful as possible to try to get this application done for you. Okay, so the last thing that resource I'm going to talk about relates to counseling. And so I'm going to start with this quote that you see here from an actress, Eva Mendes, who says, "I love therapy. There's nothing like talking to someone who has no emotional tie to my life." And I actually said that to somebody about 2 weeks ago in talking about counseling and going to counseling. But what is counseling? That's a big question that some people have. Some people use counseling and some people use therapy. It's the same thing. But what counseling is and what it strives to be is a safe place for you to talk to somebody that's not emotionally invested in your life, that can help you figure out new coping skills, how to move forward with a problem, how to move forward with relationships, how to make decisions that you've been struggling with, anything that's on your mind, big or small. A counselor can help if you find the right fit. Why go to counseling? Well, there's a million different reasons, but let's talk with what's going on in today's day and age. So we have COVID, and we're going on a year of COVID. We have political and community turmoil right now. We have stresses for day-to-day life. We are raising children at home and homeschooling them. There's relationship issues, grief and loss, trauma, and then getting a new job, not having a job, buying a house, moving. So that's just over 10 things that I can quickly name on reasons that someone might want to go to counseling. And I'm going to put out there, I'm going to speak for myself, but I also feel that I can speak for my colleagues here at Georgetown, is that when someone talks to you about counseling, Counseling should not be a punishment. Counseling is a supportive service that we want to tell you about, that there are options for you. There's also, we want to say that counseling is not just for crazy people. That is a stigma that we try to fight every day and that we've been fighting for generations. Counseling, again, is just a safe place where you can talk to someone and try to learn some new skills or move through a problem that's happening in your life. Sometimes people ask me, well, when is a problem a problem? Like, when do I really need to address it, where I can just address it over here? So the way that I look at it as is that if there is something that's bothering you that is negatively impacting your ability to function every day in your day-to-day life for longer than 2 weeks, then maybe you should consider finding somebody to talk to, or at least talk to your medical provider, okay? So it's that negatively impacting your day-to-day life. That's where it becomes a problem versus a problem, okay? So if you're listening to this and going, maybe I should try to talk to somebody or learn more about this, but you're thinking, Kim, where do I start? That's a great question. So start with, if you have insurance, start with your insurance company. Give them a call, ask them for providers in your community. They should be able to either print out a list and mail it to you or tell you how to find it online. Most insurance companies have a Find a Provider link on their websites. You can also contact your local behavioral health agency. An example, in DC, it's the DC Department of Behavioral Health. Pretty simple. If you're going to pay out of pocket, I suggest looking at reliable online databases such as psychologytoday.com. I use that on a weekly basis to help find resources for people that give me a call. You can contact the American Psychological Association, the National Center for PTSD, also the National Alliance of Mental Health, or NAMI. They have a lot of great resources on that website as well. Not lastly, but one of the things you can do is also contact me here at Georgetown, and I can help you find some resources in your community that accept your insurance. And I also want to note that if at any time you have feelings that you want to harm yourself or that you want to kill yourself, I encourage you and implore you to contact the National Suicide Prevention Lifeline. And I've listed the number here. It's free. It's available 24/7. You do not have to feel this way alone. You don't have to go through this alone. There are people that can be helpful. In addition, you can also contact 911, or you can go to your local emergency department, and someone there will help make sure that you're safe and will help find some resources for you. Lastly, before we close, I wanted to put up culture-conscious mental health resources. I've just put a very small list. There's lots of them out there, but I thought that this might be helpful for some people. Examples are Therapy for Latinx, Black Mental Health Alliance, the National Asian American Pacific Islander Mental Health Association, We Are Native for Native Americans, and the LGBT National Help Center. So the links are listed here. In closing, here is my information in order to contact me. And I'll just say that every case is different. Insurances are all different. Resources change. Where you live is different. So I would like to be a support system for you or someone that you care about as you work with our MS clinic. I am a pretty good researcher, so I can help do my very best to try to find resources for you in the community if they exist. I like to problem solve. So if you think, I might want to talk to that Kim Foster there at Georgetown, either you can contact me directly, or if you can't remember who I am, just contact your MS provider or your provider here at Georgetown, and they'll do a social work consult. They all know where to find me. So thank you so much for your time. You survived my presentation, and I think we're going to move into a brief question and answer period. So again, thank you so much for your time.
Hey Kim, want to say hi to us?
Hey everybody, thanks for sticking with us so long tonight.
Okay, so we're going to start with our first question. CJ wants to know, what are some common goals that patients have when working with you?
That's a great question. So it depends on what you're contacting me for. If it's for supportive counseling, we talk about a lot of different things. So I have some people that I work with grief and loss. I have some people that have some depressed mood. So we're trying to figure out how to break a cycle in that depressed mood. What activities would you be interested in doing, what you're invested in to try to bring happiness and joy into your life. Other goals are just getting connected to a certain resource. So example, if you're a person that says, hey, I have to get this wheelchair replaced, that's something that a goal that we need to work on together to get accomplished. So it just depends on what you're calling me for.
Great. Now, Anna would like to know, does Medicare pay for a stand-to-lift machine or power wheelchairs?
Medicare and Medicaid do have benefits for wheelchairs. They typically take that doctor's recommendation for the type of chair, and then they do an assessment because they're the one that's going to pay for it. So then they decide, are they going to pay for a power chair versus a manual chair or something in the continuum. So they do have that benefit, but it just depends on their actual assessment of you and your needs.
Great. So LaShawn would like to know, what if you are unable to leave home, but you will prefer PT at home due to the pandemic? Is that an option? Or should I reach out to my insurance company?
That's a great question. The requirements typically for most insurance and certainly Medicare are that if you can go outside or if you can leave your home, then you need to have your services outside of the home. Medicare has very strict rules around what homebound means. So I encourage you to try with your insurance company and say, hey, it's COVID. I have an autoimmune disease, or these are the issues that I have. It's also wintertime. Can I basically have these services for this period of time and then reassess and see what they say? It's more expensive to pay for in-home care. So many insurances tend to stick with their rules around who gets in-home care and who doesn't.
Great. Next question. I need reasonable part-time private pay home care services. Yet, I would like to know who will help me here in Northern Virginia.
So I have a list that's not the end-all be-all of services or home health aid services for our area that I can send you. I can mail it or I can email it to you. And then you can contact them and see what their prices are. I think I mentioned that in our area, it tends to be through these agencies, $21, $22 to $50 an hour. And they often have an hourly minimum. So for an example, some will say we have a 4-hour minimum per visit. So say that's a $25 an hour program. With 4 hours, that's $100 a day. So reasonably priced. You're probably not going to find anything in our area under $20 unless you find just someone that you know that is not from an agency. But we can get together again. If you put your information here or contact me here at Georgetown, I can easily send you the list that we have compiled.
Mike would like to know, I was awarded long-term disability for my insurance, but they required that I had to file for SSDI. After I was awarded the SSDI, they shorted the SSDI from the long-term disability award. Is that normal?
That is normal, and most companies or policies are going to do that. So an example is if a policy, long-term disability policy, is paying out $1,500 a month. And then once you get approved for Social Security Disability or SSDI, they're going to pay you $500. Then your insurance company says, oh, Now we only have to pay you $1,000 a month, and you're still going to make that $1,500. So very typical. They're going to want you to keep up with your Social Security. They're going to want your updated information, medical reports, because they're an insurance company that are for profit. So they're going to always be looking for ways that they don't have to pay you as much money. So that's very typical.
Okay. Now, in general, Sherry would like to know, how much does SSD pay monthly if you're finally approved by SS?
Okay. So I can give you a generalized answer. And I was looking it up while I was listening to the presentation. So in 2020, the average for SSI, Social Security, the SSI one, that's an average of $783 per month. Some states add their own supplemental amount, so that could be a little bit higher, but it depends on your state and where you live. The Social Security Disability, the SSDI, the average for that is around $1,260 a month. So you can see that difference of what, $400, $500 potentially, because of the two different programs.
Okay.
Hope I answered that question the right way.
Yeah.
Okay.
And would like to know, do you do virtual counseling?
So I do telehealth, and I do over the phone, and it's short-term supportive counseling. I do not bill for my time thus far here at Georgetown, so that's helpful for some people, especially if people don't have health insurance. So that can be helpful. And short-term is usually around 10 to 12 weeks. Some people don't need that much. Other people need much more time. And so I talk with people about what we think the amount of time that counseling might be projected. And if it's really long term, then I might be a support until you're connected to someone in the community, because I only have so many hours to fit in a given week for counseling on top of the other things that I do. So I don't have a big caseload for counseling services, but I do telehealth, which is video, and I do it over the phone as well.
Now, Liz wants to know, and do you know if Blue Cross Blue Shield federal pay for lift chairs for stairs?
I don't know. That's something that I can potentially research for you. We can look at together.
Again, thank you, our great Kim Foster, for hosting this webinar and teaching us so many great things that usually we providers really don't know. So I think it was very educational for me, and I really enjoyed it. So thank you, Kim, for joining us this evening. And I don't know if you want to say a couple of last words to our public here. Maybe just because they were asking for your email, so if you would like to spell that out, just in case.
Sure. So my phone number is 202-444-1018, 202-444-1018. My email is super long, so I'll try to do it slowly. It's basically my name, so it's KIMBERLY, Kimberly, .J as in joy, .foster, FOSTER, at GUNET, so GUNET, at georgetown.edu. So Kimberly.J.Foster at gunet.georgetown.edu.
All right. So again, I already put the Kim's email and phone number. You can grab it from the chat box. Thank you for joining us this evening. I had so much fun doing these things. I really enjoy it, and I get to spend time with you. So the next month, remember the last Tuesday of the month, your humble server is going to be talking about MS and race. and I will hope to see you there. And until then, you have a safe night, and thank you so much for watching. Bye.